Once you've learned how to assess flexibility, the next step is to learn how to act on the results. The tests tell you where flexibility is lacking. You must then select and prescribe the correct flexibility exercises to help your client improve their range of motion to achieve their fitness goals. What do you do with the information from a flexibility assessment? How do you know which stretches to prescribe? Which stretch is best for someone who scores poorly on shoulder internal rotation? How about someone who scores poorly on the shoulder rotation field test? After watching this video, you will be able to select appropriate flexibility exercises based on the results of the flexibility measurement. It's important to be able to translate results into action. This video will show you how to use results from field tests and joint assessments to select stretches that will improve your client's range of motion. First, we'll discuss the different joint motions because they are the foundation of joint assessment. Next, we will discuss agonist and antagonist muscle groups and their relevance to flexibility exercises. Finally, we'll review how to select and prescribe appropriate flexibility exercises based on results of field tests and joint assessments. Most gross joint motions come in complementary pairs. Here we'll talk about three major pairs. The first pair is flexion and extension. Flexion occurs when the joint angle gets smaller, and extension occurs when the joint angle gets larger. The shoulder, elbow, hip, and knee are all joints that are capable of flexion and extension, among others. The second pair is adduction and abduction. Adduction occurs when a joint angle gets smaller while the limb comes towards the body, and abduction occurs when the joint angle gets larger while the limb goes away from the body. The hip and shoulder joints are capable of adduction and abduction, among others. The third pair is internal and external rotation. Internal or medial rotation occurs when a limb rotates inward toward the body, and external or lateral rotation occurs when a limb rotates outward away from the body. The hip and shoulder joints are capable of internal and external rotation. An agonist is a muscle that shortens to move a joint into a specific range of motion. An antagonist is a muscle that lengthens to allow the agonist to move a joint into that specific range of motion. During knee flexion, the hamstrings are the agonists because they shorten to decrease the joint angle. The quadriceps are the antagonists because they lengthen to allow for flexion. If the antagonist muscle group is a suboptimal length due to inactivity, poor posture, injury, or some other reason, the range of motion at the joint will be restricted. In the case of knee flexion, if the quads are shortened in any way for those reasons, knee flexion will be compromised. The most important concept to remember when working to improve a client's range of motion is the following. To improve a specific range of motion, put a joint further into that range of motion. If I measure knee flexion of my client and find that they have achieved 10 degrees less than I expected, I need to prescribe exercises that put the knee into greater flexion to stretch the antagonist muscle, the quad. I can achieve this with stretches like a standing quad stretch, a couch stretch, or any other stretch that involves deep knee flexion. When interpreting certain field tests, it's important to evaluate them to identify the motions that are restricting movement. Doing so will help you to pick stretches to improve the movement. For example, the shoulder rotation test involves shoulder flexion, shoulder abduction, and shoulder external rotation. If my client is restricted in the shoulder rotation test, I can target flexibility exercises to improve those motions. When interpreting joint assessments, it's important to remember that you are evaluating the flexibility of the antagonist muscle group. For knee flexion, even though the hamstring is the agonist, contracting to pull the knee into flexion, I'm actually evaluating the length of the quads, or the antagonist muscle group. Flexibility exercises selected from results of joint assessments should always target the antagonist muscle group. Selection of appropriate flexibility exercises requires a basic understanding of joint motions. It helps to understand the difference between agonist and antagonist muscle groups so you can identify and target antagonists. To improve a specific range of motion, put a joint further into that range of motion. For more information about flexibility exercises, please refer to chapters 5 and 16 in ACSM's Resources for the Personal Trainer 5th edition.